Hi everyone, Dr. Emmy from Pain Free and Fit. Today, part 2 of our seated position advice for those of you with spondylolisthesis in the lower back. Learning how to choose a chair was part 1. Today we're going to be talking about how you actually set yourself up in the chair without support, avoiding the mechanical disturbances that so common irritate spondylolisthesis, low back pain. Hope you enjoy. So in part 1 of our spondylo chair and sitting advice video, we talked about determining the neutral spine, how much pelvic tilt front to back you should use, and the type of lumbar support you should use to maintain that neutral spine position. Today we're going to talk about a few of the other factors having to do with sitting and how you set yourself up in your chair to avoid aggravating your spondylolisthesis low back pain. We're going to be talking about lateral or side-to-side positions and rotational positions. Many times if you sit in a car with a bucket seat that has a wedge, so to speak, on one side, and you're not totally into that seat all the way or symmetrical, that wedge or that cradle that you're sitting in will actually help to push one of your hips slightly upwards. It just takes a little bit, maybe of a quarter of an inch of pressure. And when you do that many times repetitively in the same chair, let's say your favorite car seat over and over, that's going to tilt the pelvis up and cause a slight compression on that side of your back. Because what happens is as the pelvis is disturbed and your weight moves away, typically your upper body is going to compensate and come back the other way to rebalance yourself, to keep your vision straight. As a result, it creates compression on the discs and the facet joints on that side. It shortens muscles like the quadratus lumborum and the erector spinae, which over time, many days and many hours of practicing this, winds up with keeping that shortness as you stand to walk, as you get into your workouts, you do other things, creating an asymmetrical force in the back, many times aggravating spondylolisthesis pain. So one of the key things to do is when you get yourself in your car seat, if it does have bucket seats, make sure that your hips are symmetrically between the cradles of both sides, that you're not off slightly to one side or the other to avoid that lateral disturbance. Another very common problem in all chairs and seats when we sit that creates a lateral or sideways disturbance is the habit of crossing the legs. Many people have a tendency to cross the legs at the ankle when they sit, when they lie down, or even stand with one leg out. What this creates is an external rotation or outwards turn of one thigh compared to the other. Most people do not equally, for the same amount of time, cross legs either at the ankles or at the knees. So what happens is we have a favorite side that creates the top leg moving externally. That's turning the front of the leg outwards. This creates a shortness in the hip joint. Same thing for people who stand with one leg or walk with one leg slightly out more than another. It creates tightness in the piriformis muscle, the other external rotators, which over time creates a disturbance in the hip joint where the ball and socket of the hip actually turns into that external rotation and creates the same problem. It lifts one hip up, not only when you're standing, but also when you're sitting. So one of the things to do is to avoid crossing the legs. You want to get into the habit of making sure that both thighs are straight out, perpendicular to your torso and your pelvis when you sit, and that you're avoiding having one knee slightly turned out or flared out, or one foot. That can go a long way to promoting good, equal, symmetrical biomechanical stresses on your legs that affect your low back pain. Another thing with spondylolisthesis to be aware of is rotational stresses. Many times when people sit, if their workstation, what they're looking at, is not exactly straight ahead, but slightly off to one side, that's going to create a rotational stress, meaning a twist of the upper body, the torso, in relation to the pelvis. This, over time, creates more of a twist on the lower back, creating stress, again, on facet joints, disc fibers. You know, discs have alternating fibers. Each layer goes an opposite way. One layer moves one way obliquely, the next layer moves the next. So when we're constantly twisting to one side, that's stretching half of those fibers asymmetrically and stretching the other half in the opposite direction. Over time, this leads to more irritation. Many people with spondylolisthesis have associated disc herniations. The facet joints, as you twist to one side of the facet joint between the vertebra opens up, the other side closes. So if you're wondering why you need facet injections, chiropractic osteopathic manipulation, PT, massage therapy, because you're always tight more on one side than another, this is a very common reason. It's prolonged sitting with your chest or your eyes slightly turned to one side that creates this disturbance. The same thing can happen if the pelvis is twisted to one side. Sometimes when we get into a chair, we have a favorite side to slightly twist to, and then we watch the television, we look at our phones, we're doing computer work slightly to the other side or even straight ahead. If the pelvis is twisted slightly to the right, but our eyes and chest is straight ahead, that again is going to create a slight twist of the lower back because the pelvis is moving in the opposite direction of what the chest and the eyes. So you always want to make sure when you're sitting that you have your pubic bone, your belly button, the center of your chest, your nose, all facing the same direction. If I need to, for an extended period of time, sit with my attention more towards one side, whether I'm out socially, whether I'm at work, I want to make sure I twist either my chair or my entire pelvis and make sure that I'm sitting straight ahead. These types of tips will help to keep you symmetrical in your posture, which over long term is going to create a more symmetrical habit and more evenness on all your soft tissues in your lower back, helping to relieve spondylolisthesis pain. If you've enjoyed this video on sitting, part 2, and spondylolisthesis pain, feel free to subscribe to our channel. We've got a lot of great videos out there for spondylolisthesis, a lot of healing exercises to help you. Questions or comments or suggestions for topics on our channel, please write in. I'll do my best to entertain them and address them. And remember, if you're looking for a great rehab program to self-rehab your own spondylolisthesis low back pain, learn what your mechanical disturbances are, what your muscle imbalances are, and how to set up a program to build a healing exercise program to get over your spondylolisthesis pain and get physically active again, check out our Fast Track program for spondylolisthesis available at painfreeandfit.com. I hope these 2 series on sitting for spondylolisthesis low back pain helps you with your chronic low back symptoms.